So basically this is your radius bone. Okay. So first the location means where this bone is located. So this bone is mainly located your which region? Your forearm. Okay. So mainly your which laterally. Okay. So lateral side of your forearm this bone is located. Okay. So how you remember this bone is present your laterally? By this pulse. Okay. You always remember this pulse is mainly your radial pulse. So you see this pulse, your pulse is present radial side, means the radial pulse this is called. So this bone is present lateral to your forearm. Okay. Next, the anatomical position. Before knowing the anatomical position, you have to know the parts. Okay. So always remember this bone having mainly 3 parts. Okay. First is your upper end, another is your shaft, another is your lower end. Okay. So always remember your shaft is present in between your upper and lower end. Okay. So in the lower end, see properly, here your round shape head is present. This is called head of the humerus. Head of the radius. Okay. And here you can see one neck is present, constricted neck. Okay. This is called your neck of the radius. And here your another structure is present. This is called your radial tuberosity. So head, neck and radial tuberosity is together form your upper end. So in the upper end mainly the 3 parts. One is your rounded head, the neck and the radial tuberosity. Okay. Next, the lower end. Okay. In the lower end you can see here, in the lower end mainly your how many surfaces are present in the lower end? 1, 2, 3, 4 and 5. So total 5 surfaces. Okay. This is mainly, always remember, this is the anterior surface and this is the posterior surface, because in the posterior surface your this ridge is dorsal tubercle is present. Okay. So this is your anterior surface, then posterior surface, and this is your lateral surface, because here your styloid process is present. Another surface is, this is the medial surface. In the medial surface you can see one notch is present. Okay. One notch is present in your medial surface. This is called your ulnar notch of radius. Okay. Ulnar notch of radius. Here your ulnar bone is articulate and form inferior radioulnar joint. Okay. So this is called your ulnar notch of radius. Okay. Here you can see there are another surface is present. This is your inferior surface. This inferior surface articulates to your, this bone is called bones of the hand, the scaphoid and lunate. Okay. Here this lower end is articulates to your this bone. Okay. Means in hand bone. Okay. So there are 5 surfaces. Okay. Now the anatomical position. Okay. Always remember, first point is your, this is called your round shape head. Okay. Always remember the round shape head is present upper side, means upper end. So this is your upper end. Always remember this is your upper end, because the rounded head is always present upward. Okay. Next, the process, styloid process. Okay. Always remember this styloid process is present laterally. Okay. So this is your lateral side. So the styloid process is present laterally. Next, the sharpest border. This is called your interosseous border or the medial border. So this medial border is always present medially. So your sharpest border or the medial border is present medially. So first point is your head directed upward. Then this is the styloid process laterally, and this is the sharpest border or the medial border present medially. And next point, very much important point, always remember this dorsal tubercle always present posteriorly. Okay. This dorsal tubercle is always present posteriorly. Okay. So this is your anterior surface. In the lower end, always remember this is your anterior surface. This anterior surface is smooth. Okay. But this is called your dorsal surface. This is rough surface. Okay. Which is present mainly posteriorly. Okay. So this is your anatomical position, and this is my right sided radius bone. Okay. Next, to upper end, lower end, then the shaft. Okay. Always remember in the shaft there are 3 border and 3 surfaces. Okay. First one is your anterior border. See, this is your anterior part, means the front part. Okay, always remember there one oblique line is present starting from your radial tuberosity. Here one oblique line, this is called your anterior oblique line, which is finish your styloid process. So this is called your anterior border. Okay, so your anterior border is started from your radial tuberosity and anterior oblique line and downward. This is finishing your this styloid process. So this is your anterior border, and the posterior border are the mirror image of your anterior border. Here you can see this is also starting the posterior part of your radial tuberosity. This is called your posterior oblique line and finish your this tubercle. This is called your dorsal tubercle. Okay, so this is your mainly the posterior border. Okay, another border is present. This is the sharpest border. This is the medial border. So there are three border: anterior border, posterior border, and the medial border. Okay, and there are three surfaces. Okay, first one is your, this is called your anterior surface, which is present in between your anterior border and the sharpest medial border. So in between the anterior border and sharpest medial border, your anterior surface is present. Okay, similarly in the posteriorly, in between the posterior border and your sharpest medial border, your posterior surface is present. So anterior surface, posterior surface. Here your another surface is present lateral side mein. This is your lateral surface. So three surface, three borders. Okay, now see. So the radius bone is mainly lateral bone of your forearm, which is homologous to your tibia bone. Okay, this is called your tibia bone. Okay, homologous to your tibia bone, and this is mainly present your lateral side. Okay, see the parts. First one is your head. Okay, the next, this is your anterior border. See, this is the anterior border starting from your radial tuberosity and ending to your styloid process. Okay, so this is the anterior border, and this is the interosseous border, means the sharpest border. Okay, so in between your sharpest border and your anterior border, this surface is called your anterior surface then. Okay, so this surface called your anterior surface. Okay, similarly here you can see in the laterally another surface is present, lateral surface. Okay, now see, this is the mainly the posterior view. Here you can see head, neck, radial tuberosity, and this is called your posterior oblique line and ending to your, this is called your dorsal tubercle. Okay, so starting from your radial tuberosity posteriorly, your radial tuberosity, and ending to your this dorsal tubercle, this is called your posterior border, and in between the posterior border and the sharpest border, this is called your posterior surface. Okay, next is your, so in the parts there are three parts mainly: upper part, shaft, and the lower part. Okay, means upper end, shaft, and the lower end. Okay, next in the upper end, you all know there are head, neck, and the radial tuberosity. Can anyone tell me the muscle attachment of the radial tuberosity? Radial tuberosity का muscle attachment? Yes, biceps brachii muscle, tendon. Okay, मैंने बोला था ना वो डंबल के लिए उस टाइम यहाँ पर बाइसेप्स में पेन होता है, टेंडन में. ओके, सो द हेड इज डिस्क शेप एंड आर्टिकुलेट्स. ओके, ऑलवेज रिमेंबर योर हेड इज आर्टिकुलेट्स टू योर मीडियली. कौन सा पार्ट है तुम्हारा? कुछ मीन्स सॉरी लेटरली which condyle is present? Lateral condyle. Okay, this is called your humerus. This is called your capitulum. Okay, so this bone is articulated to your capitulum of the humerus. Okay, always remember. So the head is the disc shape and articulated to your capitulum. Okay, of the humerus, and the neck is constricted, which is present below your head. Okay, below your head of the radius, your neck is present, and next is your radial tuberosity. Here your the tendon of the biceps brachii muscle inserted. Okay, next the shaft, the long shaft extended, and in between your the shaft is present in between your upper and lower head, and here you can see There, this is called your lower border. In the lower border, 5 surfaces are present. This is called your anterior smooth surface, and this is the posterior surface. Here your dorsal tubercle is present. Another is your lateral surface. This is here your styloid process is present, and in the medial surface, one notch is present. This is called your ulnar notch of radius. Okay, and this is called your inferior surface. Here your scaphoid and lunate bone. This is mainly the hand bone are articulates to this lower end. Okay. Next, the anatomical position. Okay, write it down. This is very much important. Okay, the anatomical position. One by one, we have to discuss like this. Okay, first is your narrow disc-shaped head is always present upward. Okay, means your head, the head of the radius is present always upward. So you hold like this, not like this. Okay, because your head is always upward. Okay. Next one is your the sharpest border, which is the interosseous border, which is present medially. Okay, medially your this sharpest border is present. Another one is your styloid process, which is present laterally, and the main thing is your the always remember this tubercle is also the lister tubercles, also called the lister tubercles of the dorsal tubercle. Okay, then always remember this tubercle is always present posteriorly. Okay, so there are mainly 4 points you have to remember. See, all the points are written here, right side. Okay, tell me the points. First is okay, good. This is the right. Okay, so this is the right. Okay, because okay, first point is your head. Head is upper. Okay, head is upward. Okay, see here also the head is upward. Okay, and the sharpest border, this is the sharpest border. This is the sharpest border which is present medially, and this is the styloid process. This is the styloid process which is present laterally. Okay, and next one is your smooth surface anteriorly. Okay, the smooth surface is present anteriorly. So the lister tubercle or the dorsal tubercle is present posteriorly. Okay, so this is my right sided radius and this is my left sided radius. Okay, next the muscle attachment. Okay, next the muscle attachment. Okay, you just remember the name. Okay, because after completing your forearm dissection you just memorize all those things. Now only the just remember. Okay, name, just mug up. First, see, this is the front view mainly. Okay, so this is front view. How you know this is front? Because your anterior surface is smooth. Okay, here. Okay, so this is the front view here. Okay, so first one is your muscle attachment is your this biceps muscles. Okay, so this biceps muscles is always attached your this radial tuberosity. Next, the supinator muscle, it is attached to your mainly this part is called your which surface? Lateral surface. Okay, because your sharpest border is present here. So this is your lateral surface. Here your supinator muscles present, but your supinator muscles also present your posteriorly also. Suppose here your supinator muscles is attached now, but the supinator muscle also attached here also. Okay, posteriorly also little bit your supinator muscles is attached. So the muscles is attached like this. Okay, like this the muscles is attached. That's why you see from both view, you see in front also the supinator muscles is present, in the behind also you see the supinator muscles. Okay, so first is your biceps brachii muscle which is attached to your radial tuberosity. Okay, in the exam, in the OSPI, see, okay, see, previous exam these things are given. Here you can see this is the radial tuberosity. The question is like this: identify the mark area and name the muscle attachment here. Okay, so the answer is radial tuberosity and the muscle is the biceps brachii muscles. Okay, so okay, first is your biceps brachii muscles is attached, then the supinator muscles is attached here also, anterior also and posterior also. Okay, the next here you can see, can anyone tell me this part, this line is called, this line, can anyone tell me this line? This is called, this line is called, which is finished to your styloid process. Yes, anterior oblique line. So this is the anterior oblique line. Here your FDS, flexor digitorum superficialis muscles is attached. Okay. So flexor digitorum superficialis muscles is attached to your this anterior oblique line. Okay. Always remember. So first one is your in the radial tuberosity biceps brachii muscle. Next the supinator muscle which is present lateral surface along with the anterior view and posterior view. The next the in the anterior oblique line FDS, flexor digitorum superficialis muscles. Below this here, so can anyone tell me this surface is called which surface then? Anterior surface. In the anterior surface, the muscles is the flexor pollicis longus. Okay. So this also flexor, this also flexor. Okay. So FPL, flexor pollicis longus. And here, your another muscle which is present lateral surface medially. ये तो तुम्हारा lateral surface ही है. Lateral surface medially. Here you can see your pronator teres muscles is attached. Okay. And below it, another muscle is attached. This is mainly the this part. Okay. This smooth surface. This is called your pronator quadratus muscles. And here little bit in your styloid process, this brachioradialis muscles is attached. Okay. So just remember the name. Okay. After completing your dissection part, this thing really very easy. Okay. Just remember first supinator muscle, then biceps. Mainly these things are asked. The radial tuberosity muscle attachment. The next the in the anterior oblique line muscle FDS, flexor digitorum superficialis. Then below it your flexor pollicis longus. Here your pronator, here also pronator teres, pronator quadratus. Okay. Next, see here only the two muscles in the posterior view are attached. This is the abductor pollicis longus and extensor pollicis brevis. But biceps brachii, so yes, here also here attached means the radial tuberosity. Okay, the supinator muscle also present, pronator teres is present, lateral surface medially. Then the abductor pollicis longus and extensor pollicis brevis are muscle attached here. Okay. So this is mainly see one by one. First the biceps brachii muscles is inserted your mainly the posterior part of the radial tuberosity. You just remember in the radial tuberosity your biceps brachii muscles is attached. Next the supinator is attached to your mainly the lateral surface. Okay. It extends anterior to posterior. Okay. Remember. Next the pronator teres. Pronator teres कहाँ पर था तुम्हारा? The lateral surface medially. Lateral surface medially. The lateral surface medially your pronator teres muscles is attached. Next the brachioradialis, small attachment here. In remember just in the styloid process. In the styloid process, okay. In the styloid process, this is present. Okay. Next the pronator quadratus. Where it is located? The pronator quadratus, this smooth surface. Okay. This smooth surface. See, in the smooth surface, this pronator quadratus muscles is attached. Next is your the flexor digitorum superficialis. दो muscle था ना, flexor. This is present mainly this oblique line, anterior oblique line, FDS, flexor digitorum superficialis. Okay. Next one is your the flexor pollicis longus below, means mainly the anterior surface में upper 2/3 में this muscles is attached ना. The flexor pollicis longus. Next is your the from the behind there are two muscles attached. One is your which is mainly present your posterior surface. Okay. The abductor pollicis longus and extensor pollicis brevis. Okay. So that's all about the muscle attachment. Okay. Only 8-9 muscles is attached. Okay. So this bone is very much easy. Okay. Just remember there are 3 parts: anatomical position, mainly this radial tuberosity. Okay. And how you remember this is right or left by looking the 4 points mainly. Okay. Then little bit of your muscle attachment. Now the ossifications. Can anyone tell me? Ossification means? Yes, formation of new bone. Okay. Okay. Next, can anyone tell me what is the difference between the primary center and secondary center? Yes, means the intrauterine life. This is the primary. And secondary center? Afterward. Okay. So here you can see the primary center appears mainly the shaft during the 8th week of the fetal life. Okay. But in case of the secondary center, it appears in the lower end of the first year and the join the shaft around the 18 years. Okay, and next the secondary center appears in the head of the bone during the 4th and 5th year and fuses the shaft at the 16th year. Okay, okay. So first is your mainly the anatomical position, location, okay, little bits of parts and the muscle attachment, then ossification, then next the clinical anatomy. So these questions comes as a short note also. Okay, pulled elbow. Okay, you all know na this ligament, this annular ligament, one ligament is present around your head of the humerus, also the neck. Okay, and also your this humerus also. Okay, here one ligament is present. Okay, always remember this ligament is in case of children in between the 2 or 5 year, this ligament is tubular in shape, like tube like structure. Okay, so if mother pulled her this wrist, so easily this means broken or dislocated, yes, or slips out, okay, easily, because this is funnel shape, sorry, tubular shape. Okay, easily these things are means slips out. But in case the adult, always remember this ligament, mainly the annular ligament, is funnel in shape. So if this funnel in shape, do not easily slips out. Okay, so that's why in case of the 2 and 5 year children, this situation is happen. Okay, by pulling this wrist, this is called your pulled elbow. Okay, so this thing mainly happened. See, when the children is suddenly lifted or pulled up by the forearm, the head of the radius slipped out of the annular ligament, called the subluxation or the incomplete dislocation. So the clinical symptoms is immobility, because okay, immobility, inability to use the limb, next the pain, and next is the restricted the supination. Can anyone show me the supination of your yes, this is the supination. So this movement are not happened here. Okay, okay, this movement is restricted. Okay, next, so if this movement is not happen, so the child keeps the elbow flexed or supported in the slight flexion or pronation. So this is called your pronation. Okay, so child not done this movement. Okay, so the head is pronated, sorry, the hand is pronated. Okay, here. Okay, so this situation called your pulled elbow. So mainly the main point is that this annular ligament is slips out. Why? Because in case of the children this is tubular in shape, but in case of the adult this situation are not happen, because here it is funnel in shape. Okay, that's why this pulled elbow is happen in between your 2 to 5 year children mainly. Okay, next another thing, this is called your Colles fracture. This is called your also the Fork deformities. These things happen by your fracture of your distal radius. Okay, this is the distal part. Okay, lower part mainly distal part, distal radius. Okay, here these things are broken and this situation is happened. Okay, see, it is due to the fall of the outstretched hand, means fall from this type of movement. Okay, तो देखा है ना, मतलब पैर में चलते हुए ऊपर से गिर गया तो आउटस्ट्रेच हैंड ऐसे होने से, सो ये these things are happened. Okay, mainly so deformity caused by the dorsal displacement of the distal radius. Okay, and this is also called the Fork deformities. Okay, this look like this. Okay, so this situation is called your Fork deformity. So how you manage this case? This things is called the sling. Okay, sling, by using the sling means the immobilization. Okay, always remember in any kind of fracture, one word in the management, always remember immobilization the limb. Okay, by using this sling. Okay, so that's all about your radius bone. Okay,